94.1 WHRP, Tony in the morning and DJ Primetime 256. And we are so excited to welcome to the show Dr. Whitney West for our WHRP Wellness Wednesday. Good morning, Dr. West.
Good morning, Tony. How are you?
Doing great. So glad to have you with us. And it's perfect timing because it is Breast Cancer Awareness Month.
Yes.
And we are trying to get as much information out for our listening audience on the importance of breast cancer and getting exams and self-examinations. But before we get to that, we want to know a little something about you. You've been in the Tennessee Valley for quite a while. And for nearly 3 decades, you've been providing Huntsville women with unparalleled care, creating safe and nurturing environmental, I guess sort of like a nice vibe and place for people to come and get their health care taken care of, a gynecologist, and just really focusing on women's health. Tell us more about yourself.
Well, thank you for having me. Yes, I've been in town for about 23 years. I just recently opened up my second private practice where I'm focusing strictly on gynecology as opposed to obstetrics and gynecology. But my whole goal, my entire career has been to educate women on themselves, their bodies, and all of the things that we as women come in contact with. So that's my goal. Trying to get folks well here in Huntsville.
We love it, and there's a lot of women who are serious about their health and always getting their checkups on. For me, I have my checkups. I always use Women's History Month as my reminder to get my mammogram. Mm-hmm. And of course, as we're getting closer to the fall, I try to make sure I get that annual, checkup and everything. All that said, it is Breast Cancer Awareness Month. And tell us what you feel the importance of having these examinations are for people, and how old should you be before you get that first mammogram?
Everybody's different. So the standard for ACOG, American College of OBGYN, has some guidelines, and they say around 40 and every year, every 1 to 2 years, based on average lifetime risk. So that means there isn't anything that makes you at increased risk for having breast cancer. So about age 40. What I typically do is get my 35-year-olds between 35 and 40, what we call a baseline mammogram, get them scheduled for that. And if that's normal, then we don't do anything until they turn 40. But what I do is educate them on self-breast exam, which you can do at any time. I typically tell them 5 days after your period goes off, that's when your breasts are the most normal. And I give them a handout. I shows them how to do it. It's real simple. You can do it in the shower or while you're putting lotion on or whatever. It's really simple to do. It takes, I don't know, a minute or two if you're paying attention. And what's really important is that you know what is normal for you, because every woman's breast is different. So if you know what your breasts feel like on the days when they are the most normal, then you know when it's not normal.
It's Wellness Wednesdays, and we're talking to Dr. Whitney West. Now, Dr. West, I know you're big on women's health, but how can men as well do self-checks to see if anything's going on with them as well?
Well, they can do the self-breast exam as well. And it's really important if they have a family history of breast cancer, because men, they get it less often than women. It's about less than 1% of all breast cancers are men. But they have some of the same signs. So they can feel a lump, they can have itchy, scaly skin, they can have puckering or an inverted nipple when it's supposed to be pointed out, it's pointed inward, those kind of things. So if they notice that, then they need to be evaluated immediately.
So we're talking to Dr. West, and this is all great information, self-examinations. And, sometimes when we do bring up the men and breast cancer, some people are hearing it for the first time. So let me ask you this question. Can men get a mammogram?
They won't be scheduled like women are on a 1 to 2 year basis. If something is found, then depending on their breast tissue, they may be able to get into the machine. I mean, logistically, men don't have the structure. Their breasts aren't built the same way, and
They don't protrude out.
That's well, that's correct. There's some who have what's called gynecomastia, which is enlargement of the breast tissue, and that can be from medical conditions or medications or just obesity that causes the breast, but they technically don't have the breast tissue that women would have. And I'm gonna tell you honestly, sometimes it feels like the technician who helps you do the do the mammogram, they find tissue that's not there. So they start pushing and pulling, and
I kind of wish men could get a mammogram, doctor.
Right.
Well,
They get you don't get the prostate exam. Their prostate exam is what they call their, that's their mammogram.
That's their okay.
That's another conversation.
Okay. Oh, we don't want to talk about that today. Talking to Dr. Whitney West, and she is helping many women with gynecology as well as women's health. Tell us what a gynecologist is. What kind of doctor is that?
So gynecologist is a trained physician in the field of basically women's health. So we manage reproductive health. Most of the time it's obstetrics and gynecology. Obstetrics is for pregnancy related conditions. And then gynecology is everything else related to the female.
So if you're looking for a new doctor or you want to get more information on your health and wellness, you may want to hit up Dr. Whitney West. Do you have any words of encouragement for the person that still has yet to get a mammogram and to check themselves out for possible breast cancer?
I always try to encourage, just because I think more information that you have, the better off you are. Some people look at it the other way. They're like, I don't want to know. It's not, but if you ignore it, it's still happening. Right.
Yes.
So if you educate yourself, and you're doing your self breast exam, you're getting your clinical breast exam yearly, and you actually get your mammogram, then there are resources that you can obtain if something goes awry. So it's not a death sentence. It may be, a bump in the road, but there are ways to manage it. Obviously there's treatment and that kind of thing. And then there's certain things that can be done, you can do in your life to help prevent it from happening. So.
Well, we're hoping that people will take heed to that. And of course, we appreciate all of the insight today. Dr. Whitney West, how can people stay in contact with you? What are your social sites? And do you have a website?
I do have a website. It is www.westmdpc.com. And I am on Instagram, Doc Whitney W. And then Facebook is Dr. Whitney E. on
All
Facebook.
Right.
Yeah.
It is Wellness Wednesday with Dr. Whitney West. We want everybody to do a self-examination, or if you haven't had a mammogram in a while and you're way overdue, treat yourself and your family by getting that examination, because we want you here. We want you to be healthy, and we want you to participate in all the fun things we have in store for you here at WHRP Breast Cancer Awareness Month. So Dr. West, empowerment, empower wellness, a journey, not a destination. I love that tagline. This is our lives, and it's not to be played with. So I'm encouraging you, PT.
I'm encouraging you as well. Go get it done. Men, it's for you as well. Do that checkup.
Yeah. And if you're, as she was saying with the men, I thought was interesting, PT, was the part where she was expressing how with men on your nipple, if it's inward, like it's dimpled in.
Yeah.
And there's some guys that are ignoring that, and that could be a possible sign.
Men, we ignore all the signs of everything, okay? I'm one of them, okay? I also had a lump in my chest, and I had to go get it taken care of as well. So please don't ignore the signs, like Dr. West just said. just because you ignore it does not mean it's not happening. All right.
Oh.
Take care of your bodies.
What's your phone number, Dr. West?
860-337-9378.
All right. Call Dr. West. It is WHRP Wellness Wednesday with 94.1 WHRP.